recording.
Shalom and hello, everybody. I am Janet Holdeen from the USA. The spiritual, physical, and emotional cleansing training today is taught by Dr. Santi Kitling Lee. She earned a PhD in clinical psychology at a California university. Her first doctoral study was in biblical education in the US. She was also trained in the College of Nutrition in Toronto and was an educational therapist. Now, please welcome Dr. Lee.
Welcome.
Hi.
Shalom, shalom.
Shalom. Today, I'm going to present Talk21, Developmental Disorder, Part 2, Management of Adolescent and Adults. And as you know, my Talk 20 is on Part 1. I advise you to go back to listen to Part 1. Today, I will continue. But however, I will do some review so that you just refresh your memory. Let's go to definition. The developmental delay affects a person's ability to regulate behavior, control activity level, inhibit impulsive response, or sustain attention. Then the same group. You have to compare at the same age. This condition causes academic, social, and career impairment at different levels, different degrees. Okay, and then let's go to, because in my Talk 20 I already mentioned about from age 1 to 20 to earlier 22. So today we talk about let me see, different age groups from age 9 to 15. The age group regarding the ADHD, mild autism. Why I write down mild autism? Because in severe autism, they are out of space. Asperger disorder, learning disability, giftedness. Sometimes a person can have both. Learning disability on one hand, and in some areas, that person is so gifted. Tourette syndrome and tics. Okay, let's look at age 9 to 15. This period of time, the person is so searching, super sensitive to one's own identity. This person will ask, who am I? Experiencing identity crisis, body image, because the person will change from child body to adult body. Developmental deficiency, school performance, inattention, learning disability, or giftedness. Concern about peer. Can I be accepted by my peers? In this age group, with those conditions, is extremely important for the peer to be accepted. We have similar problem, but at this group of people, they are very sensitive to be accepted by the peer group. May feel shame, may feel shy, especially parental, if they grow up in a parental separation condition or divorce. Sometimes they go another extreme, feel arrogant. I'm the best in the world. And they have a question about faith, about spiritual area. They would like to do so much soul searching. So it's a good time to talk about faith to them. Sometimes they feel unwanted, outcast, rejected, neglected, frustrated, confused, shame, fear, experiencing some control issue. Also, they may deny, they may lie, they may cover up, they may blame others, they may defile authorities. They may be resentful, spiteful, even rule-breaking. So being the teacher, being the parents, elderly sibling, they have to suffer the struggles. Let's look at emotional and spiritual thirsty. They need love, a lot of love, security, discipline, guidance, attention, regularity, consistency. Consistency would be important for them, so they feel secure. Assurance, make sure, oh, you're wonderful, you're loved, you're precious. Affirmation, especially a place that gifted area, and let them experience joy, encourage perseverance. As I talked last time, this individual, they have the strength would be perseverance. If they like certain things, they will persevere. They may experience kindness. They need to experience kindness and learn self-control. Let's look at about age 16. After they gone through that upheaval in the life, then reach 16 to 22. This is a time for college and career development. Learn independency. Mom or dad, I have to move out to go to university or college. And they are exposed to different kinds of temptation, and they may develop addiction. And now come to a time to see who like me, who love me. It's a time for mate searching. Okay. Mate searching. Okay. Let me see if I have to go back to the slide. Management. Let's look at management. But however, do I have the slide on 823 and up? Okay, let me see. Yes. I have the slide on 823 and up. Especially the ADHD, Asperger disorder, learning disability, giftedness, Tourette syndrome, and PIC disorder. They have challenges and struggles. I mentioned this last talk, but it's important for me to refresh the memory. They may experience low self-image, insecurity, frequent change in life goal, relationship, school, job, school, job, and living environment change. They move from one place to another, change school from one to another, change job from one another. Various form of procrastination. This is very especially challenging to them when they don't like to do specific things. They will delay. Rigidity. Oh, come on, perfectionistic. Very aim at 100% perfect or 105% perfect. Addiction may interfere their self-care, social life, professional life, financial involvement, and marital or family commitment. During the dating period, they may change lover, and when they even commit to get married, they may have doubts and they may not be able to commit long term. It's a challenge for them, so they need a lot of encouragement, supervision, and support. comorbidity with depression, anxiety. Oh, sometimes the professional may diagnose them with depression or anxiety, but they have not been diagnosed with this above condition. So I can call it a misdiagnosed. Addictions, comorbid with addictions, poor anger management, and personality disorders. As I said just a minute ago, misdiagnosed or underdiagnosed make the situation even worse. So they need to seek the right therapist who know this area to perform proper assessment and long-term treatment so that they may maintain the conditions or bring some improvement. Look at the strengths. They are creative, artistic, athletic, sometimes average or even high IQ, multitask, compassionate, enthusiastic, heroic. Oh, they are bold to try many new things. However, when they find something very interesting to them, they would be workaholic, perfectionistic, detail-oriented, yet persistent, perseverance, spiritual. Not only when they were younger, then they are the most spiritual group among all kind of comparing to the normal population. So most of them, they may get into more knowing, want to learn more about faith, more diligent, zealous about faith, and searching on the right type of religion or faith. Innovative, they are very creative. Adventurous, investigative. Look at the strength. They are not garbage in the society. However, at school, they may not be discovered. They have so much strength that they may fail in language, they may fail in math, they may fail in the academic area, but they may be very excellent in music, in physical education, or in art, and even business management too. Okay, let's look at management. I talked about it last time, about stimulant drug, just like Ritalin. This type of drug is usually recommended to the patient with ADHD. Look at the harmful effects on brain and mind, agitation, hostility, abnormal thinking, hallucination, confusion, permanent tick. Wow. Do you want that? No one wants it. Hair loss, drug addiction, skin disorder, rash, or and then blood disorder, liver disorder, abnormal twist, spasm of eye muscle, convulsion. Bridget explained detailedly in the book, talking back to Ritalin. So if possible, stay away from this management. Okay. Okay, let me see if I have I guess I have the non-medical comprehensive treatment. Let me see, go back to here. Go back to this slide. Yeah. The non-medical comprehensive treatment include evidence-based. They are effective for long-term improvement, such as nature therapy, heal the body, mind, and spirit through meditation. I'm talking about looking at the nature, experience the nature, experience the real creator. I'm not talking about transcendental meditation. Okay. But just, by touching the flowers, look at the ocean, you feel so much relaxed. Look at the body treatment. I can provide nutritional advice and exercise. Well, how to deal with the soul? They're so searching. Emotion, deal with the emotion. So they need psychotherapy, group therapy, marriage and family therapy to provide security and discipline. Art or music therapy, speech and language therapy, even vocational counseling. It depends on the age group, so they need all kinds of services. And look at the spiritual need. They need spiritual guidance, knowing the truth, and tasting fatherly love from Yehovah, and experience the power of the Holy Spirit. Okay, so this is the bibliography I draw from around 35 resources. And just pick up some it may interest you. First one, Adams, the everything time management goal. The third one by Russell Barkley, I mentioned last time, attention deficit hyperactivity disorder. He is the expert in this field, but he recommends medical treatment. And the next one, he and his partner Benson to write this book, Define Trial. Okay, next one, how to deal with your acting up teenager. The next one I just mentioned, Redmond. Okay, let me see. The middle one, Cloud and Thompson, Boundaries Face to Face, good book to read. Oh, Dr. Dodson, Love Must Be Tough. Love is not boundless. Okay, love must be tough. It's a will. Actually, love is a will, not only feelings. Okay. Let me see. Hollowell. Oh, he is the expert in this field. Hollowell. I mentioned last time Edward Hollowell, Dr. Hollowell. When he started learning medical treatment, medical school, then he realized he had ADHD, and then since then he developed the expertise in the area. He wrote this book, When You Worry About the Child You Love, a reassuring guide to solving your child's emotional and learning problems. I read quite a bit of his book. And then he and his partner, friend, Rati, Driven to Distraction. This is a powerful book. Recognizing and coping with ADHD from childhood through adolescent. Many people, they think ADHD only for children age group. No, it's a misconception. From 0 to the day you die. Okay, even though you're 95 years old, if you have ADHD, you fall into this category. Okay, Lockley, different minds. Okay, let's look at the next one. Okay, the last one, marriage risk, risk taking, especially people they have ADHD, they have difficulty to maintain faithfulness and keep the marital relationship. That's why, as I said, they need a lot of support. Oh, Dr. Michael Lyon. Wow, this is Healing the Hyperactive Brain is very powerful. And let me see. The next one by Mate Scatter, How Attention Deficit Disorder Originate and What You Can Do About It. Okay. Actually, I'm in the middle of doing some research on brain work and our brain and our nutrition. I hope the book can bring some good knowledge that I can use to manifest and make it beneficial to the group, to my SPEC group. Okay, let me see. Again, Barclay, the ADHD book. Okay, let's go to this page, second book. So many ideas to train your autism spectrum disorder children. Oh, Ratey and Johnson write the shadows syndrome, coping the behavior. And Sorosi. Oh, this book, Sorosi, Unveiling the Mystery of Autism and Pervasive Developmental Disorder. This book suggests some good idea about autism. And Superior on Parent Talk. Okay, last page. The developmental mind, how relationship and the brain interact to shape who you are. Okay, and then the last one about divorce and parental disagreement for people experiencing ADHD. See, repeatedly, different experts writing ADHD, they experience disharmony in the marriage. So I recommend those realize that they have ADHD before they get married. They better face it and treat it before they enter into marital relationship and become parents. Okay, and that's the end of my talk. So if anyone they like my teaching and they felt like to offer me something, send me a money gift to encourage me, you are welcome to do so. You can go either PayPal, email to Dr. Lee consultation at protonmail.com, or you can send by Western Union. Make sure you put my first name, Sandy KL, and my last name Lee. I'm from Canada. Okay, thank you, Father, for touching your heart to offer me some help, financial help. May Father Yehovah richly reward you. Now, I finished the talk. Let me see if I can see everyone. Okay, so as I know today, many people, they either, for whatever reason, they're absent, but that's why I still can see some of you. And I'm so happy to see Janet and see Austin. Don't see your face, but I know you're here. And any comment, any question?
I have my hand up.
Go ahead.
Okay. I would just like to comment on that last reference that you had. If you the last one about relationships,
yes.
how it shapes your life actually.
Yes.
So could you go back to that and just read that person's name, please?
Oh, I see. Okay.
Because I really want to talk about that one.
Okay. Let me see if I can.
The last slide.
Yeah, I know. See if I can go back to share screen or not.
Well, you just you don't have to unless you just want to. But
I can type the but anyway.
Well, just the name and the book.
It's a general article.
It's an article.
Yeah.
Okay, and so yeah, I would really like to expose that as far as my life is concerned.
Okay.
Yeah, and relationship. I mean, it's a little history here. I don't know how much longer we have and before they close.
I want to stop you. When you go back to my slide and with the last one, then I hope you get hold of the information, and then you get hold of the Journal of Developmental and Behavioral Pediatrics, 22.2 April. Okay.
Oh,
So you
okay.
go, get hold of this information by staying dealer resident. But anyway, you will search it, okay?
Okay.
About your life story.
Yeah, oh, no problem. I just want to let you guys know that thanks to Jehovah number one, and the fact that he took me out of a environment, since I am adopted, that was not compatible to me and my development. And so when he put me into this new family, I was doing fine until it was exposed to me that my adoptive mother was not my mother. And that set off a landslide, an avalanche in my spirit. I was, how old was I? 8 or 9, somewhere along in there. But at any rate, I just absolutely felt was totally disassociated, so to speak. And I remember screaming and hollering and crying and crying and crying and unconsolably. And I know Mama, she tried to tell me that she loved me and that she got me. I was a total mess because my whole life, from 8 days old, I can't remember back that far, but from 8 days old up until that moment, that was my mom. You know what I'm saying? And that was all I had. That was all I knew. And I want to tell you that information is not always what you say, is how you say what you say. That sometimes can really make a difference in your life. And so when I found that out, I understood then why my life was such a turmoil, because I had not come, that has not been explored with me, that had not been, because I just, my whole spirit, my soul was totally fractured, just like the grains of sand upon a seashore. That's the way I felt. And so during our session with Dr. Santi, we went back there and we talked about it and explored it. And really, I just wanted to feel, a part of. I wanted to feel belonging. I wanted to feel like my mom that I loved so much was my mother. I wanted to feel that more than anything. However, that was taken away from me because I chose to, because I felt like I didn't belong. It wasn't that my mom didn't make me feel like I belonged, but I chose to do that. And it's just like my whole life was just totally, totally, uh, totally devastated, and my relationships and my it was terrible. I want to tell you, it was just terrible because I always felt inferior. I always felt like I wasn't good enough, and I could not bring it together. And yes, I have trouble with my husbands, more than one, and I was very clingy, and just the idea of not of feeling of rejection totally was destroyed me, just totally. And, you know, like people may not understand that, but the fact that my temperament is such that I, with my nuclear family, my children, my husband, that's my whole life, because the other had been taken away from me, so to speak. And I just, I've been praying and praying and praying and asking God to help me, and you know, help me to come to some kind of rationale with my feelings and how I felt I was totally devoid from my mom. And I found out during genealogy research that my biological, the lady that raised me, my mom, was actually my cousin. And so that, I'm gonna tell you the truth, that was a connection that I needed desperately, to know that yes, I am related to this woman, even though she was gone. You know, she passed away long before that. But I'm gonna tell you, that made a huge difference in my life. And then the fact that going through the session with the Dr. Santee and bringing things out, and so I had to face it, even though I didn't want to. I was screaming and hollering all the way, no, 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 I don't want to do this. But I'm going to tell you, it really, really, really helped me to understand why. That was my question, why I was doing the things I was doing, and I didn't understand it. And so yes, it makes a whole big difference on with the children. And the last thing I remember that was so profound to me, Dr. Santee, and I didn't tell you this yet, but when you said that, and Ethel, who told me that my mom wasn't my mom, was the only one that was telling me the truth, I didn't want to accept that. She did. She was the only one. I think, honestly, think that was not the right time to tell a little girl that, you know, it was terrible. But at any rate, for me right now, to really appreciate her telling me that mama wasn't my mom, you know. So now I can look back on it and appreciate it and not feel any animosity, but I can really feel really grateful for knowing. Like Dr. Santee said, suppose I had gone on all my life and never knew, because nobody else was going to tell me. See, but I just really appreciate Jehovah and how he moves in our lives. And, you know, and we don't know why or how or when, to what extent or whatever, but he wants us to, the weaving of the fabric to be cohesive, and that there be no holes in the fabric. And so for that, I am extremely, extremely, extremely thankful for the time that we shared together, Dr. Santee, and the fact that, you know, I know sometimes you would say, oh, this girl, I don't know how I can get through to her. But I'm going to tell you guys, thank you, Dr. Santee. My life, you know, it just solidified my relationship with the Creator and accepting his will for my life. And so maybe somehow I'll be able to share that with somebody else, and just to let them know that Jehovah is so in control. And even though you hurt, even though you have problems with relationship, even though I I was dyslexic, I still am dyslexic. It's very difficult. For me with words, with math, things like that. I just displace things, and it's hard for me to concentrate because my mind just just goes, and it's like I can't remember things, you know. And Right. Just today, I was asking Jehovah to please help me to remember.
We can
And
also, help you increase your memory.
yeah,
It's
yeah. So
powerful testimony. I'm so happy. ADHD has 6 types, and people have the type of hyper focus. They may experience similar problem you face, and hyper focus don't realize bigger picture, only focus on the problem. And
yeah,
may people listen to your testimony and encourage, and if they like, they seek the proper therapist to know about this developmental disorder, or you're all welcome to contact me and receive counseling. Okay. And
well, yeah.
okay, our time is almost up, and we can continue with the next session, but I need someone to have a short closing prayer.
I will,
Okay,
if
please.
that's okay.
Yes.
Baruch atah Yahovah, thank you for your love and your kindness and your mercy. Father, you are so great and greatly to be praised. Thank you for this